Did you have a fundraiser?
Well, it seemed like that was the longest, that would offer the longest survival rate. That's what we thought.
3 years.
It's been over 3 years, yeah. And he had been messed up since maybe April of that year. You know, we noticed his leg, not walking on it, and we took him to the first vet, and they thought it was a misdiagnosis. They thought he was getting arthritis or something, a joint problem or something.
When they told you that his leg had to come off, what did you think?
Well, they didn't say it had to come off. That was just an option. There could be palliative care for a year. Our interpretation, what the doctor said, was that you've got known cancer site here. We'll get rid of that where his leg was, his back leg. And then if he left the leg, then he would maybe try to use it, and then it would break because it's deteriorating. So it seemed to the best thing to do for his sake was to cut his leg off.
He's a big dog. How did he do with recovery?
Well, actually, and he had all this stuff, I don't know, leaking, and when they have the collecting the fluids that come out. He had a rough couple weeks at home, and kept him isolated from the other cuckoo dog we have. He seemed to do okay after a while. The expense was a big deal, and it was probably at least $5,000 initially for the leg. So then I guess we probably dropped another at least that much probably, because his chemo is a little over $500 a quarter every 3 months going and everything.
What would you say to somebody who's considering chemo for their dog with cancer?
It certainly helped our dog, and if they can afford it, you love your dog, and as far as I think those are the basic things. Do you want to let your dog die, or if you don't want to go that route, you want to keep your dog alive, then the chemo, and you can afford it. The chemo seemed like kept him alive. It certainly worked with us.